Hi, it's Bill, the Knee Pain Guru. Today we're going to talk about the three main reasons why your knee can't bend after knee surgery. Before we get into that, it's important to understand what is going on with your knee post-surgery. Your body just had a major trauma, surgery, no matter whether it's like full-blown knee replacement surgery or just arthroscopic like keyhole surgery. Your body has experienced a huge trauma. And when it experiences that trauma, the natural response the body has to a trauma like that is to tense up to protect itself. This is what you're dealing with. This is what your body is dealing with and working with post-surgery. Now, this is not taking into consideration how long you've been in pain before the surgery. So now you've had trauma that has taken place in your knee with the initial injury, however long you were limping around on your knee before you actually got surgery, which was another trauma. So in both scenarios, well, in all scenarios, your body has experienced a trauma. So what does it do when it experiences a trauma? It tenses up to protect itself. That tension is what your body is fighting when you're trying to get range of motion. So a lot of people point to why you aren't getting range of motion in the knee. One, they'll blame it on scar tissue. That's like the main culprit, that the doctors, physical therapists have a certain expectation on the other side of the surgery as to your progress. You're supposed to have a certain degree of extension and or flexion in the knee after surgery. What ends up happening, though, is because of this trauma, your body tenses up to protect itself. That tension, your body, the tension that is stuck in your nervous system and the neurology of your leg prevents the body from getting full extension or flexion in the knee joint. So what does your body do when it has that tension in there is it builds scar tissue up to protect the knee so it doesn't go in that range of motion. The conventional medical thinking is, well, if we break down the scar tissue, then you'll get the increased range of motion. It's actually just the opposite. So we're going to get into that in just a minute. But so the three main reasons that you can't bend your knee after surgery is, one, the knee hurts. It's experienced trauma. So that natural response to the surgery, the trauma, the injury, the accident, whatever happened, that is preventing the range of motion from happening in your knee. The second is because your knee's not comfortable. So this kind of goes back to what I was saying. The doctors think to break down the scar tissue, but breaking down scar tissue is painful. If we get the knee comfortable, regardless of the scar tissue, the natural range of motion, the natural movement of the knee, because it's comfortable, will break down the scar tissue. So now we got to stop doing what's painful. We got to create comfort in the knee to increase the range of motion, which will naturally break down the scar tissue. So that's the second reason. The third reason is because the body, your body, is an interconnected series of pulleys and levers, meaning when your knee hurts, the rest of your body compensates to protect the knee. So you're going to have tension in your hips, your lower back, your ankles, your feet, your hamstrings, your quads, your calves, your shins, all the way up your back, your shoulders, your neck, your jaw, all compensate for your knee. Whether you want to believe it or not, this is what happens. Excuse me. So now that interconnection of all of that tension going from your head to your feet is just pointing to the knee as being the problem. But in actuality, we have other tension patterns primarily going on in the hips and the lower back, that when we start freeing up those patterns in the hips and the lower back, frees up the knee. You get an increased range of motion in the knee just because we freed up the tension in the hips and the lower back. So, this is good information. Give a thumbs up to the video, like and subscribe to my channel. You could also, there's more information on my website, thekneepainguru.com. You can go there and get there's a 7-day knee pain reduction challenge there. Once you log on to the website, you sign up. I have 7 days worth of training where I work with what I refer to as a stretch or a pain pattern interrupt to get comfort in your knee, to beginning decreasing the pain, which increases the range of motion. You can go over there and check that out right now. That's what I was going to share today. So those 3 things, once again, the 3 main reasons why your knee can't bend after surgery. One is the trauma. Your body is protecting itself, normal, natural response to what you've been through. That's the first thing. Second thing is because of the trauma, there's pain in the knee, so the body resists the bending of the knee because of the pain and forms scar tissue. So we create comfort in the knee, we break down the scar tissue, and we increase the range of motion. And the third reason your knee can't bend after surgery, after knee surgery, is because of the tension in the hips and the lower back and other areas of your body that are all contributing and creating, help contribute to the tension in the knee. So that's what I want to cover today. Once again, like the video, subscribe to my channel. There are a couple of my buddies on the line here, Cohen and Lloyd. If you have any questions, please ask them about knees. Scar tissue can scar tissue, should you try to stretch it? Scar tissue does become more flexible. It breaks down when you make it comfortable, and that will actually break down scar tissue. You'll see, I've had a number of scars that when they first happened, you can feel the hardness of the scar tissue underneath the skin. Sometimes the scar will actually be a bump. And the more create comfort in that, the more that's worked, that the scar tissue breaks down, becomes more flexible, it actually kind of dissipates. I'm not so sure that what's left in my knee or other areas where I've gotten cuts from accidents, injuries, that it's actually considered scar tissue anymore. And trying to stretch it, here's an interesting piece. Hey, Gail. Hey, Bill. How you guys doing? Stretching scar tissue. Here's an interesting piece. You want to work the scar tissue to the level of your ability to tolerate the pain. If you stretch scar tissue and throw your body into such an experience of pain that it takes you days to recover afterwards, then you've stretched it too much. On the other end of the spectrum, working the scar tissue, not working the scar tissue enough, allows it to be stagnant and then actually build more scar tissue. So you got to kind of find that balance between the two extremes of doing nothing and creating so much pain in the scar tissue that you're left in pain for days afterwards. Finding that middle ground, and in that middle ground, beginning to learn how to create comfort in the scar tissue in the joint will allow that scar tissue to break down. So, Lloyd, does that answer your question? Let me know. Hey, Don. Hey, Travis. What's going on, guys? If you have any questions about knee pain, scar tissue, lack of range of motion, and this is interesting, the lack of range of motion sometimes doesn't even have anything to do with lack of range of motion doesn't necessarily have anything to do with a surgery or a trauma. Hey, Karen. Hey, Ali. Anybody have any questions, let me know. Sometimes lack of range of motion in the body just comes from our patterns, meaning like we sit in a chair, our legs that are always at 90 degrees, our hips to our lower back is always at 90 degrees. And what ends up happening is the scar tissue or tension forms in the body in those areas where we can't get the range of motion back in the knee. See a lot of people suffering with arthritis, bone on bone, that kind of thing. That's all they ever sit. They've not gotten the range of motion in their knees past 90 degrees because they never sit anywhere or never squat down that much. And what ends up happening is it forms like that scar tissue or the fascia that essentially forms in the body, forms how we move and how we sit, how we stand and all that. And that'll kind of lead kind of like ruts in an old dirt road. We won't be able to go outside of those ruts. We go back into those places of how the body is used to moving. So that's what I had to share today. If the information is good, like it, share it with your friends, especially those that limp. This will be good information for them. If they're not in Facebook, this video will also be on YouTube. If you're watching this video, I send the links to this video out to my newsletter. Go over to the left here. I have some programs that you can begin getting started with. The Comfort Zone and Quit Your Quack, which is a 6-week private Facebook group where I coach people out of knee pain. That is actually going to start April 16th. So all that information, if you're on my newsletter, is over to my left. Okay, how do we heal the mental scars from when I had to do a tick check on you in the Pine Barrens? That's trauma that can never be resolved on. Okay, let's see. Setting up later today, hoping to share info about your program. Great, Karen. Thank you very much. Appreciate it. That's what I got. So once again, like the video, share with your friends, subscribe to my channel, and I'll see you on tomorrow's video. Have a great day, everybody.